Does menopause affect your joints? Let's talk about it. Do you ever wonder why you're falling apart? Seems like you hurt yourself a lot more often, spraining ankles, wrists, or shoulders and hips, back pain. The reason your joints ache is that your hormone levels decline drastically by the time you reach menopause. Low estrogen affects collagen production and the strength in your tendons, while low progesterone affects the production of joint cartilage. Your sex hormones do a lot more than control your reproduction and your moods. They also help to keep your joints healthy. Collagen is a protein matrix that helps to connect tissues. Collagen synthesis is disturbed when your estrogen levels start to fall, which leads to weak muscles and joints. But very high levels of estrogen can negatively affect your joint strength, which is why women athletes are more prone to tendon and ligament injuries than male athletes. High levels of estrogen in pregnancy helps to soften up the ligaments of the pelvis so that the pelvic girdle will widen to deliver a baby. Super soft tendons and ligaments do support proper joint function, but very stiff tendons and ligaments are actually dangerous. High levels of testosterone can cause tendons and ligaments to stiffen and rupture with activity. So it's important to make sure testosterone and estrogen are in a good ratio. You need much more estrogen than testosterone. For my menopausal patients, we get their estrogen and progesterone balance well before considering testosterone replacement. Postmenopausal testosterone production is still fairly stable up until 70 years of age. If testosterone levels fall significantly, it can be difficult to build bone and muscle, so it's time to start replacement, but testosterone must be in proper ratio to estrogen. And don't forget progesterone. Progesterone stimulates the synthesis of cartilage. As your progesterone levels fall in perimenopause, your cartilage thins, which is why we start to see signs of osteoarthritis as early as in the 40s. Now, here are 3 tips to help prevent and heal joint issues in menopause. Number 1, hormone replacement therapy. Bioidentical hormone replacement therapy with a balance of estrogen and progesterone, and after 70, or if you have osteoporosis, testosterone as well, can help keep your joints healthy. Number 2, resistance exercise. Weight resistance exercise can help strengthen ligaments, tendons, bones, and muscles. There's lots of ways to do weight resistance exercise. I recently strained both of my Achilles tendons by walking too far in not very supportive shoes. The treatment has been to warm up the area with heat and then do some eccentric loading exercises, lifting my heels up off the ground and back slowly in multiple repetitions, both with a straight knee and also with a bent knee, as well as each leg separately. Just within a few days, I noticed a tremendous difference in my Achilles tenderness, using my own body weight as resistance, and as my tendons get stronger, adding resistance by carrying a backpack or holding onto a kettlebell. Now, if you have any questions about joint health in menopause, please join me in our hormone support group, where I answer your questions live, and you can get access by signing up for my free hormone reboot training. Number 3 is collagen peptides. Studies show that consuming supplemental collagen peptides can help heal damaged tendons and ligaments faster than resistance exercise alone. While collagen is produced from the protein you eat, your collagen production becomes limited as you age. Now, you need at least 2,500 milligrams of collagen peptides fortified with at least 50 milligrams of vitamin C to help you heal your joints. I'll see you in the next video.